Welcome to the WashU Medicine Mallinckrodt Institute of Radiology's Cyclotron facility in nuclear pharmacy. This training video is brought to you by the PED-RTRC, which is an NIBIB P41 grant-funded center. The cyclotron facility activities include preparation of human-use radiopharmaceuticals, manufacturing of clinical radiopharmaceuticals, development of experimental agents for use in human clinical trials, translation of radiopharmaceuticals from bench to bedside, production of radiochemicals, and general radiopharmacy activities. The production of radioactivity for medical use has been done here at WashU since the early 1940s and was even active during the Manhattan Project. The facility has been active in its current biomedical focus and location since the 1960s and has continuously grown to become one of the nation's most diverse radiopharmaceutical production facilities. It's important to note that today's demonstration is intended for learning purposes only and should not be used as a direct guide for the production of this drug product. All local and national rules for the production of research drug products should be adhered to and may vary from what this video provides. Today we are going to demonstrate the production of one of our in-house developed agents, carbon-11 CS1P1. This is a positron emission tomography or PET imaging agent developed by Dr. Will Tu for the visualization of the sphingosine 1 phosphate receptor 1, or S1P1 for short. S1P family of receptors has been implicated as a mediator of several different cellular processes, including cell differentiation, migration, survival, and inflammation, to name just a few. Due to carbon-11's short half-life of 20 minutes, this agent is not widely available through the common distribution approaches used for agents like F18FDG. Therefore, the use is restricted to medical facilities with cyclotrons, production equipment, scanning equipment, and trained personnel on site. The production of C-11 CS1P1, as demonstrated today, is not the only method that can be used. There are many different ways in which this drug product can be produced and should be validated within each facility. Carbon-11 is produced on medical-grade cyclotron through a p-alpha nuclear reaction, starting from naturally abundant nitrogen gas with 1% oxygen to yield carbon-11 carbon dioxide. This material is then transferred as a gas to a suitable radiochemistry processing unit. In this case, you can see the computer graphics used on the GE-FX-MEI reaction module. The carbon-11 carbon dioxide is trapped on a stationary phase and eluted off to be chemically converted in the gas phase to carbon-11 methane by heating in the presence of hydrogen gas and a nickel catalyst. The C-11 methane is then converted to gas phase to C-11 methyl iodide by superheating in the presence of iodine gas. To efficiently perform this chemical process, the material is circulated via a recirculation pump to ensure ample time within the high-temperature oven in the presence of gaseous iodine. Finally, the carbon-11 methyl iodide is passed over heated silver triflate to be converted to carbon-11 methyl triflate. Prior to beginning of the chemical preparation of C-11 CS1P1, there are several crucial steps that must be completed. It is important at this point to note that all steps employed throughout the preparation of a radiopharmaceutical must be performed by personnel that have been trained and signed off on each specific step. In addition, all steps should be recorded using an appropriate means of documentation, such as a paper batch record or suitable computer program. One of the most crucial steps in the preparation of C-11 CS1P1, or any radiopharmaceutical for that matter, is the aseptic assembly of a final drug product vial. This begins with the operator entering the lab environment after donning the appropriate garb, which includes lab coat, shoe covers, hairnet, face mask, and, if needed, beard cover. Immediately, the operator proceeds to the sink and performs a hand washing procedure, which includes cleaning under the nails and no less than 30 seconds of washing with appropriate soap and warm water. Once hand washing is complete and the hands are dry, a pair of gloves are donned. The operator then proceeds to assemble the materials needed for the specific final vial, which includes the vial, final filter, vent filter, and needles. All materials are sourced as sterile and pyrogen-free and should adhere to internal specifications for the specific drug product. Some final vial assemblies may also include syringes used for the drawing of QC samples, which is not demonstrated in this specific case. Materials are assembled in an appropriate staging area adjacent to a certified laminar airflow workbench or biosafety cabinet that has been operated for no less than 30 minutes prior to use. The morning of the day of operation, the workbench must be cleaned using both sporicidal and appropriate antibacterial solutions. The specific cleaning protocol used should be validated at each site. The operator now proceeds to don sleeve covers, which are immediately sprayed down with 70% isopropyl alcohol, and then a pair of sterile gloves are donned over the existing gloves and again sprayed with isopropyl alcohol. The operator now disinfects the outer pack of sterile wipes and proceeds to open the wipes and douse with isopropyl alcohol. This is used to wipe all surfaces within the laminar airflow workbench. After a suitable drying time, the materials used for the final product vial are sprayed with isopropyl alcohol and loaded into the laminar airflow workbench. These materials include growth media in the form of contact plates and air settling plates, which we use for environmental monitoring of the assembly process. The materials are allowed to dry along with the operator's hands and forearms prior to starting of the assembly. The operator carefully assembles all components and avoids shielding the vial from the primary clean air, which is being supplied vertically. After the vial assembly has been completed, the operator touches all fingers to the first contact plate and uses the second contact plate to sample the surface directly below where the vial was assembled. The settling plates at the rear are then opened and left open for no less than 20 minutes. Once all activities are completed, the vial can be placed in a sterile bag for transport to the point of use, and the laminar airflow workbench is cleaned to remove any growth media on the surface. The operator enters into the lab to prepare the HPLC mobile phase to be used in the production process. As with all locations, the operator must don a lab coat, shoe covers, hairnet, face mask, and beard cover if appropriate. Immediately, the operator proceeds to the sink and performs a hand washing procedure, which includes cleaning under the nails and no less than 30 seconds of washing with the appropriate soap and warm water. Once hand washing is complete and the hands are dry, a pair of gloves are donned. The operator then proceeds to assemble all the materials needed to prepare the HPLC mobile phase, which in this case is a mixture of 51% acetonitrile and 49% 0.1 molar ammonium formate buffer. This begins with the operator weighing out 6.3 grams of ammonium formate and transferring this to a pre-cleaned 1-liter graduated bottle. This is then dissolved in approximately 600 milliliters of 18 megaohm water and swirled until homogeneous. To this is added 1 milliliter of 90% formic acid, and the solution is diluted to 1 liter. Using a graduated cylinder, 245 milliliters of 0.1 molar ammonium formate buffer is then measured out and combined with 255 milliliters of acetonitrile. The final step is a vacuum filtration through a sterile filtration apparatus to provide the ready-to-use HPLC solution. The preparation of C-11 CS1P1 will occur today within one of our standard production environments. The operator enters into the gowning and garbing anteroom and shuts the door after entering. This gowning procedure begins with the donning of a clean lab coat, followed by a hairnet, face mask, and beard cover if appropriate. The operator then dons foot covers before stepping over the line of demarcation into the lab. All materials not already present in the lab needed for the preparation should be carried into the production environment at this time. The operator then washes their hands in the same manner as was shown previously. This is followed by donning of gloves. Upon entering the production environment, the operator turns on all necessary gases for the automated reaction module. In this case, these are manual valves located at the top of the production hot cell. The hot cell can then be opened and surveyed to ensure no radioactive material is present before proceeding any further. The operator can then log onto the computer controlling the automation reaction module using his or her personal credentials and password. The preparation of C-11 CS1P1 will be demonstrated today using the CTI Siemens methylation module. This module is designed to have multiple components replaced between syntheses to avoid the potential of cross-contamination. Additionally, the module has many components that are reusable and need to be cleaned between syntheses. The cleaning of the fixed components of the module is performed by passing water followed by acetonitrile through each part. This is a systematic process that must be done in a specific order to achieve a properly cleaned unit. After all components have been cleaned, the operator replaces all the components that have been removed from the previous synthesis. These include needles, connectors, and tubing sets. The operator assembles all the materials needed for the preparation of carbon-11 CS1P1. This includes the previously prepared HPLC mobile phase and a final vial assembly, along with the chemical precursor, acetonitrile, trifluoroacetic acid, 5 normal sodium hydroxide, 200 proof ethanol, normal saline, sterile water for injection, a preconditioned C-18 set pack cartridge, reagent vials of various sizes, and various syringes and needles to aid in the loading of production unit. Prior to loading any of the chemicals on the reaction module, the operator places the HPLC mobile phase and ensures that the appropriate C-18 semi-prep HPLC column is present on the reaction module. A slow flow can be started to ensure no leaks are present and that the HPLC system is functioning properly. To a 1 milliliter V vial, add 0.2 milliliters of 5 normal sodium hydroxide and 0.65 milliliters of the HPLC mobile phase. Cap and install on the module with both a vent and extraction needle through the septum cap. From a 100 milliliter vial of sterile water for injection, remove 40 milliliters of the volume using a 20 milliliter syringe and spinal needle. Leave the spinal needle in the vial and install on the module. Place the HPLC outlet onto the spinal needle and place an additional needle through the septum to serve as both a vent and means of creating pressure through gas flow. The preconditioned C-18 set pack cartridge is then placed on the module and waste and delivery lines are added to allow for material to flow through the C-18 to waste and be collected after elution in the final product vial. It is essential to have proper venting of all vials that collect the materials. The final vial assembly can then be loaded into a lead pig and placed into the shielded antechamber below the primary hot cell and connected to the final product outlet line. Since the C-11 methyltriphtylate is being prepared on a separate reaction platform, the operator producing C-11 CS1P1 must communicate to both the chemist performing this step and the cyclotron operator in order to begin the preparation of the methyltriphtylate. Roughly 11 minutes before the delivery of C-11 methyltriphtylate, the operator must prepare the precursor solution. This is done by adding 300 microliters of acetonitrile to 1 to 2 milligrams of the precursor and vortexing until completely dissolved. The vial is then placed on the module and the delivery line for C-11 methyltriphtylate is inserted into the vial. As a last step of the preparation, 250 microliters of trifluoroacetic acid is placed in a 1 milliliter V vial, capped and placed on the module. Needles are then inserted to allow for transfer of this reagent into the reaction vessel. The methyltriphtylate as a gas will be added to the reaction vessel, which can be observed by the increase in radioactivity within the reaction vial. The vial will then seal, and the system will automatically heat to 70 degrees Celsius and hold for a total of 5 minutes. To the reaction vessel is then added the trifluoroacetic acid, which is allowed to react for 5 minutes. The reaction mixture is then neutralized by the addition of 5 normal sodium hydroxide mixture. The reaction mixture is then transferred to the HPLC loop for purification. During the purification, a graph of the UV detector and radioactivity detector will be displayed on the computer screen. The operator must watch carefully to be able to collect the radioactive peak corresponding to the desired product. Starting the collection of this peak will automatically divert the stream of HPLC flow to the 100 milliliter vial containing 60 milliliters of sterile water for injection. Once the collection of the peak has been completed, the operator changes the flow path of the liquid so that the diluted radioactivity can pass through the C-18 set pack. This is accomplished by pressurizing the vial. The set pack is then rinsed with 20 milliliters of sterile water for injection. The elution of the C-11 CS1P1 from the set pack is accomplished by eluting with 1 milliliter of 200 proof ethanol, followed by 10 milliliters of normal saline. This material is then transferred to the final part vial through the sterilizing filter by means of manual push using a 20 milliliter syringe. The radioactive drug product is then removed from the production hot cell and relocated to a laminar airflow hot cell. At this point, a quality control sample is removed from the bulk and a bubble point of the final product filter is performed. The bubble point is checked by placing the filter with needle into a suitable liquid and connecting this to a finely regulated compressed air source. The pressure to the filter is slowly increased until a steady stream of bubbles is observed. At this point, the pressure is noted, which must pass a predetermined pressure value. The quality control sample is delivered to qualified individuals that have been signed off to perform the necessary testing of this specific drug product. Preparation for the sample testing begins well before the sample arrives, with non-radioactive standards being injected onto both the analytical HPLC and the gas chromatogram, or GC, to ensure that the system is operating correctly. This also aids in making sure that the systems will be ready for the sample upon arrival. The QC operator aliquots the sample out to various vials and quickly checks the pH of the sample using a quick read pH strip. Each file is then loaded onto the corresponding instrument and the system is initiated to begin running the sample. Since the sample is radioactive, extreme care must be taken to avoid any lab contamination during this process. Bacterial endotoxin testing is also run on each and every injectable drug produced. This process uses a Charles River portable test system that has an automatic readout of results and built-in standards to add robustness to the testing. This process takes up to 20 minutes to complete. After all results have been obtained, they're tabulated and reviewed by qualified personnel to release the drug for administration to the patient or volunteer. All documentation, including the batch record and QC results, are then assembled for final review and storage. To deliver the drug to the scanner, the material can be physically walked over, or if the distance is too long, a pneumatic tube system can be employed to send the material over vast differences in very little time. Post-release of the drug product, inoculation of the material into growth media tubes, followed by incubation and periodic checks for growth, must be performed over a 2-week period. Only after no growth is observed can the drug be deemed sterile. Thank you for watching today's video. For more information on the procedures described today, or to schedule a one-on-one training session using this video as a guide, please contact the PED-RTRC leadership or the WashU Cyclotron facility and nuclear pharmacy. Contact information has been displayed for your convenience.